Hi, for my Bacterial Pathogens extra credit project, I chose to talk about the disease Coccidioidomycosis and its pathogenesis. This disease is more commonly known as valley fever. This disease is commonly found in the southwestern United States, particularly in California and Arizona. Interestingly, it used to be more commonly found in Arizona, but in recent years it's been most of the cases have occurred in California. The disease is also found in Mexico and Latin America. The pathogens that cause this disease are Coccidioides and Coccidioides Pathogenesis. Um, the reason that I chose to talk about both of these bacterial pathogens is because they're almost identical in both their methods of transmission and in the disease that they uh, result in. So not much difference to distinguish them by. So the pathogenesis of these bacterial pathogens is that they first start out as fungal arthroconid arthroconidea, which are spores. These spores are dispersed into the air in dry desert areas when the dirt stirred up. Inhalation of dusty air allows these spores to be transported to the lungs. Once in this warm environment, these spores are able to transform into spherules. Spherules then mature and move to endosporulation stage. These endospores swell and form large endospore-filled spherules. So this is second generation of spherules. The spherules burst, which allows the fungal life cycle to repeat. The symptoms of this disease are a dry cough, a fever, a loss of appetite, and lethargy or depression. Interestingly, only about 40% of individuals affected actually show symptoms. It's very common to be infected with this disease whenever visiting endemic areas and to never have symptoms. Symptoms will often go away on their own, but sometimes can become serious and require treatment. Instances where this disease may become serious are when it results in pneumonia, meningitis, or pulmonary nodules or cavities. Um, this disease or these symptoms can vary in severity. Pneumonia is the most common one. It can either be uncomplicated pneumonia, which often doesn't have a huge burden, but it can also become chronic pneumonia, which can have a lasting impact. The disease burden, estimated costs of $7 million just in California alone. That's from a 2017 study. Um, like I mentioned with the pneumonia, um, estimated 75% of symptomatic patients will miss a week of work, which isn't that serious. But whenever the pneumonia becomes chronic, there's an estimated average of 43 days of work missed. And the average lifetime treatment cost for symptomatic infections is $57,000 in California. Thank you.